Hello, viewers. Welcome to I Want Second Opinion. This is Visionary Walks at IWSO. Today, we have got Dr. Gopi Krishna. He is a consultant dermatologist and cosmetologist with special interest in aging. He works in one of the premier institutes in Bahrain. Today, the topic of discussion, of course, is aging. It's not so common topic, but an important day-to-day topic, and most importantly, a vanity subject which all classes of the life and all age groups will be pretty interested to be knowing about it. Now, we are planning to do a series on this aging process, and today will be an introductory session on aging by Dr. Gopi Krishna. Hi, Gopi.
Hi.
Hi. It's the first time we are seeing you in this channel. Welcome to the channel.
Welcome. Yeah. And yes, tell me.
Gopi, could you please tell about yourself to the viewers as to what you are, what your specialty is, and more about you, please?
Yeah. So I'm Dr. Gopi Krishna, consultant dermatologist, cosmetologist, and sexually transmitted diseases consultant, working in Bahrain for the past 7 years. Have an experience of almost 26 years in this field.
Right. Okay. Fantastic. Nice to know. Nice to know, Gopi. Now, shall we start right into the topic?
Of course, of course.
Fantastic. Thanks,
Pleasure.
Gopi.
And
Now,
before initiating, I just want to congratulate Dr. RP for this excellent initiative you have undertaken.
thanks,
And
yeah.
yeah,
Appreciate it.
uh, and this kind of initiative is going to take us heights. I mean, in the medical profession as well, and also will be beneficial for the common public because this is a medical educative platform, a podcast. It seems.
It is picking slowly. It is picking up actually. Okay. Now let's jump into the topic,
Yeah.
Gopi. For the knowledge of the general public, could you please explain to us as to what exactly is aging, particularly in the context of our body, please?
Yeah. So aging, by definition, this is an inevitable, complex biological process which leads to cumulative changes in the cells and tissues. As a
Okay.
dermatologist, by defining a skin aging, I would say skin aging could be influenced by intrinsic and certain extrinsic factors.
Okay. All right. Okay. Now, can you elaborate the signs of aging, especially with those that are related to the changes in our body, please?
Yeah. So the changes in aging, particularly the skin, I can say that wrinkles are the primary markers of aging.
Yeah.
Because up to 20, we are not at all bothered about aging. So the wrinkles start appearing after 20 years of age, usually around 30 to 35 years, which are
Mm.
called expression lines.
Okay.
Expression lines, or also known as what do you call dynamic lines. Okay, so later, during 35 to 40 years, they become static lines, or
Okay.
they deepen to become permanent lines. So
Right.
wrinkles are the primary markers of skin aging. Apart
Right.
from this, we see dryness of skin, dullness, fatigue, and dark spots, aging spots as well. And the skin becomes coarse sometimes. There can be changes in the hair and nails as well. As you
Okay.
know, the graying, baldness, and the loss of hair is the primary, I mean, the main part of aging. And the nails also would become fragile, brittle, dull. The toenails become hard and opaque, and it loses the transparency.
Okay. All right. Okay. So it affects in the skin, the nail, and the various other parts of the body externally, and internally, of course, it doesn't. That we are not going to. This is not under our purview here. Now, Thanks for detailing about that. Uh, from the medical perspective, are there different types of aging, and how do they impact the body differently?
Yeah. See, from the medical perspective, as I said, there are two types of aging: the intrinsic and the extrinsic aging.
Yeah.
Intrinsic, mainly genetic, hormonal, and metabolic process play a role.
Okay.
Even ethnicity play a role.
Hmm.
Whereas in the extrinsic, usually ultraviolet radiation, the ionizing ultraviolet and the ionizing radiation play an
Yeah.
important role, apart from the pollution, chemicals, and the toxins, external toxins.
Right. Okay. All right. Okay. Now, could you please provide us about some insights about the history of the anti-aging approaches and the treatments that has been brought in from uh, way back, and how has these perceptions and the trends and the methodologies have evolved over a period of time? How has
Yep.
this happened?
See, when you look into the history of anti-aging, it's really fascinating to know that we all know that we are aware that the Queen Cleopatra, the
Hmm.
Egyptian queen, she indulged in daily donkey milk baths
Oh yes,
because
I have heard about that in the literature. That
yeah,
is that really a true statement? Is it or?
yeah, it was really a true statement because this donkey milk consists of high amounts of alpha hydroxy acids, which nowadays we use it as chemical peels.
Ah, so it
Yeah,
is a true statement.
yeah, it's a proven statement in the research. And then came Galen, who formulated the first cream in this world. He was a Greek physician. Uh, he formulated it with rose water, almond oil, olive oil, beeswax, and so on. And then I can say in the 15th century, sorry, 15th century, English women used slices of raw meat on their faces to reduce wrinkles.
Aha.
And in the 17th century, French women they used aged wine to exfoliate their skin.
What was it? The topical application.
Yes, topical application.
Okay.
And here in the Persian Gulf, there was one teacher called Abu. I'm not sure. Abu Al Qasim, I think. So he prepared some perfumed lipstick and deodorants.
Mm-hmm.
And I think the first commercial cream was formulated in the US in 1927.
Mm.
And in 2000, actual cosmetology came into practice after 2002, when Botox was introduced, FDA approved, and in
Okay.
2003, fillers started coming into the market, and the rest is history.
Aha. All right. Okay. So it's a long drawn process, actually. Yeah. Okay. So it's fascinating to see people. Of course, vanity is a big issue that needs to be everybody's important point of view. And I'm glad to see that the donkey's milk does have some scientific backing to that, actually. And does anybody still practice the donkey's milk now?
I don't think so because it took right along. I mean, 700 donkeys. It said that it more than 700 donkeys to accomplish this act, like daily donkey milk for Cleopatra, which is really impossible nowadays.
Okay. So this donkey's milk that you're talking about, is it a kind of a preventative methodology, or is it a kind of a treatment of the already
No,
existing
no, she was using as a regular ritual of taking shower with
ah,
alpha hydroxy acid to brighten her skin.
all right. Okay. All right. Okay. Now, so coming to the aging process, specifically to the anti-aging process, what are the factors that are involved in the process of anti-aging? And can you focus on the general aspects of anti-aging as a kind of a preventative methodology rather than after it happens, what to do kind of a stuff?
Yeah, yeah. See, the risk factors involved in aging, I could say, I usually tell my patients a simple formula
Okay.
H2S4. There is number one is H2 is healthy eating habits. Sorry,
Sure.
eating habits, of course.
Yeah.
Unhealthy eating habits,
Yeah.
poor hydration,
Fine.
stress,
Okay.
sleep deprivation,
Yeah.
smoking, and spirits.
Right. Okay. So that is H2 and S4.
Yes. Yeah.
Okay.
So the formula would be you have to prioritize your sleep, cut down smoking, and try to avoid caffeine and alcohol to the maximum, as well as try to have healthy eating habits. Try to develop healthy eating habits and stay hydrated throughout.
Okay. You were talking about caffeine. It is interesting. In what way does caffeine affects the aging process at all?
See, it has merits and demerits.
Okay.
So, concerned with anti-aging, it said that drinking more than 7 cups of, coffee a day,
Hmm.
it can promote, it decreases the microcirculation in your skin, the vasoconstriction.
Okay. Oh,
Yeah,
right.
yeah,
Okay.
which will lead to aging process. That's it.
Right. Okay. That's fine. So, are there any general principles or guidelines that one should follow to address the aging process? I suppose this comes into the purview of all the six factors you talked about, I guess.
Yeah. So the thing is, I already mentioned the formula, how to prevent all this.
Yeah.
In addition, I should say that because intrinsic aging, it's really difficult to address.
Yeah.
So
That's right.
aging can be easily addressed by
Yeah.
using sunscreens because sunlight
Mm.
is one of the major factor for aging.
Okay.
Yeah. So, and using sunscreens, proper use of sunscreens, and taking antioxidants, as well as doing, exercise regularly. Okay. That too, there is, limits. Like if you are doing vigorous exercises, you need to, at least 75 minutes a week. Or
Mm.
moderate exercise, we advise 150 minutes. That is 30 minutes a day for 5 days a week
Right.
with moderate exercise. That will help.
Okay.
Yeah.
So,
And as you know, meditation and yoga, of course.
yeah, lifestyle modification and good practices, that is I think it's a dictum for any pathology that is being affecting the human health, I suppose. Yeah.
Yeah. On a long term, it will have a positive effect.
All right. Okay. You were talking about the unhealthy food products in your first hedge.
Yeah.
What, apart from caffeine, are there any other unhealthy food products that our public needs to avoid, or anything at all? Or there is any direct deterrent over there?
I would say junk food is the major culprit nowadays
Mm.
because we don't have, because we are grown up with homely food.
Yes.
Nowadays, youngsters, we see that they are addicted to junk food and this sodas as well.
Oh,
So the aerated drinks. So this is going to take a toll on their aging process. It's
yeah.
definitely.
Oh,
And I think we should stick on to regular eating habits
mm.
and try to have more of vegetable, fresh fruits and vegetables. Usually, it's said that you should eat 5 servings of fresh fruits and vegetables a day,
Yeah.
and try to cut down on red meat.
Right. Okay. Yeah. Yeah, that's a concept that is evolving as regarding the any anti-inflammatory food to cover avoid red meat. Actually, yeah,
Yeah.
fine. Now, thanks for telling us about the internal factors or how the public themselves will be able to look after the health.
Yeah.
Can you give us as to how a professional like yourself will be able to come into play and try and help in curtailing the aging process of the patient?
See, thing is, educating the public is of priority nowadays,
Absolutely.
because people live in fantasies. They
Hmm.
do not know the actual pathology, how life goes,
Hmm.
and how skin has to be nurtured, or
Yes.
how skin health has to be maintained.
Hmm.
So we dermatologists have a very important role in the society and the community.
Yeah.
So first of all, I I don't jump into a treatment for any patient. I
Sure.
always
That is good.
advise
Health
them
education
to,
plays an important role. Yeah.
yeah.
Okay.
So I help them with the do's and don'ts,
Okay.
and I do not give them any temporary fix for their cosmetic concerns.
Yeah.
I address the issue from the fundamental.
Okay.
Okay, so that the with the lifestyle changes, there will
Hmm.
be changes in the skin as well. So
Okay.
I advise them, see, say smoking. Smoking is going to reduce the microcirculation in the skin, leading
Okay.
to wrinkles, fine lines, elasticity.
Yeah.
It will cause under eye bags,
Oh,
dark circles around your eyes,
okay.
and say even what do you call it, this can lead to a generalized dullness and roughness of the skin, and
Okay.
even the droopy mouth around the on the oval commissures. So
Okay.
then I advise them for the uh, to avoid sleep deprivation. So 8 hours of sleep is a must for everyone.
Okay.
Okay, so you have to prioritize your sleep as well, because
Yeah.
and sleeping pattern,
Hmm.
when you sleep, the compression, the shear force, all are important in producing wrinkles. That's why we have asymmetry on the face. Each one of us will have asymmetry on the face.
Yes, I have
Because
observed that whenever we are watching. Yeah. Yeah.
yeah. So you can see even the profile they take, the photos they take, selfies they take, some will be good in the left and some would be good at the right. This is
True.
because of the sleep patterns.
Okay. But in what way does sleep pattern affect one side of the face specifically? Is that the way in which we sleep or?
Yeah. The way in which we sleep is very important. We should not sleep on the face. Okay, we should not sleep laterally for a long time. So there are certain norms for that. So those
uh,
things I teach them, which
okay.
we can discuss when we come into, the details of it. And
Fantastic.
then I tell them to cut down sugar, because sugar intake is, with increased sugar ingestion, there will be cross linking of collagen, because we know as we age, the collagen decreases by 1% every year after 20 years of age,
Hmm.
which has to be replaced. So there
Okay.
is loss of collagen, loss of elastin, as well as loss of hyaluronic acid.
Okay.
Okay, so these have to be replaced. So I
Yeah.
ask them to cut down sugar. So sleep, sugar, and I can say this. I advise them to increase the intake of herbs and spices as well, like oregano, cinnamon, cloves, garlic, and onion, because these are going to, reduce the what you call the glycation end products.
Hmm.
Even a diabetic patient will have more of glycation end products, which is
Okay.
going to, which helps in speeding of aging.
Right. Okay.
Yeah. And the fourth thing I would say is dry skin. Dry skin occurs because of uh, im- they don't have adequate knowledge of the pH of the skin. The
Hmm.
pH of the skin is usually around 5.5. So it's
Okay.
so it's acidic.
Hmm.
So using hot water
Hmm.
for taking shower is going to increase dryness. Second thing, after taking shower, you have to moisturize your skin within 3 minutes after bath, because there is something called transepidermal water loss, where the water evaporates from the skin. So you
Okay.
have to moisturize
Yeah.
within 3 minutes after bath when the skin is damp.
Right. Okay.
And I also tell them, because usually in elderly we see they take hot showers. They
Hmm.
feel good with hot showers. People
Of course.
having itchy skin will have hot showers,
Hmm.
and they forget applying moisturizer thereafter. And also, I advise them not to use alkaline soaps because neutral soaps you can use like Dove soap. I'm not because I'm not supposed to tell the commercial names, but we have neutral soaps.
Hmm.
And second thing is there are synthetic detergents which are called scented bars. So they do not dry your skin.
Right. Okay.
So you have to advise them to use this kind of soaps or this kind of bars or moisturizing cleansers and
Right.
moisturize your skin immediately after shower. So this
Okay.
will avoid dry skin. And of
Hmm.
course, we know pollution, the stress, everything has to, this is taking a toll on our skin aging.
Absolutely. Yeah,
Yeah,
that is always there. Uh, you mentioned neutral soaps. Yeah, neutral pH soaps, is it?
neutral pH soaps. Neutral
Uh,
pH soaps are soaps which have pH around 6.
okay. Okay.
Because
And one.
alkaline soaps, mostly soaps are alkaline in nature.
Yeah.
So alkaline soaps are going to, because there is a protective covering in our skin which is called acid mantle.
Okay.
So when you use alkaline soaps, this acid mantle is disturbed.
Hmm. Okay.
That paves the way for the external attack, like antigen or pollution or whatever it is.
Yeah.
So try to use only neutral soaps or synthetic detergents to maintain the pH of the skin, to balance the skin as it is.
Right. Okay. Thanks, Gopi. It gives me a lot of perspective. I'm learning quite a lot, actually. Much appreciated. Now, uh, before we go into the in-depth in our forthcoming series that we have spoken about, can you highlight about what are all the innovative or advanced treatments do yourself, like a cosmetologist or a dermatologist, now have at your disposal in order to combat the aging process?
Yeah. See, we have an armamentarium of lasers and non-laser procedures for at our disposal for
Yeah.
anti-aging. So,
Okay.
starting from, I'll say, apart from Botox, fillers, for various indications, the basic and the advanced indications, we also do skin boosters and certain injections called platelet rich plasma for the face and the hair,
Okay.
exosomes for the hair, exosomes for the face. Okay, exosomes. They are extracellular vesicles. They're like intracellular communicating molecules. So these all are going to have an anti-aging effect.
Okay.
And as I said, exfoliation can be easily done with chemical peels.
Okay.
And we also have ready-made peptides, which is called mesotherapy for
Yes.
as injectables.
Okay.
And yeah, and taking into the lasers, we have lasers for pigmentation, for tightening lasers. We have wrinkle reduction lasers. We have hair removal or hair reduction lasers, and tissue tightening or collagen remodeling, high intensity focused ultrasound. It's called HIFU. HIFU machines, which can tighten your skin and give an anti aging or lifted look.
Right. Okay. So these are all kind of a prophylactic measures that you put in place in order to curtail the aging process, or are these measures that are available where already an aging process has been reflected in the skin or in other parts of the body where you try to mask them or put them back in position?
That's a good question, Arpi, because as I earlier said, I do not jump into all these things straight away. I
Okay.
always address the fundamental issues,
Yeah.
see to that The lifestyle modification can be maintained. The diet, healthy diet can be maintained. Cut down on these carbs and sugars as well. Do a proper exercise. Reduce stress to the maximum. Sleep
Yeah.
for 8 hours. All these things are definitely going to help them in the long term anti aging process.
Okay.
Then I assess the patient. As
Yeah.
after assessment, I look into the specific issues which is really bothering them.
Okay.
Say, if a patient has a good elasticity of the skin,
Hmm.
I'm not going to do a HIFU for lifting.
Okay. Okay.
Okay. If
Hmm.
if she or he doesn't have wrinkles, that much of wrinkles on the
Hmm.
forehead as the crow's feet as well,
Hmm.
I'm not going to address them with Botox.
Okay. Okay.
Okay. Just see, things are like different nowadays because I'm living in the Gulf. Gulf women are after cosmetology.
Okay.
I get patients right from 12 years of age.
All right. Okay.
How,
Vanity,
how, how
vanity,
can
vanity. Yeah.
Yeah. So how can you advise them to go for a cosmetic treatment?
Hmm.
So
Hmm.
never. Even the
Hmm.
parents bring these children for cosmetic procedures.
Okay.
Yeah, which I strongly disagree.
Hmm. Hmm.
So cosmetology is for something which cannot be replaced, and we are replacing with cosmetology procedures. That's it.
Okay. Okay.
So that's my view.
Okay. All
Yeah.
right. So it's not going to be like a general cohort approach. It's going to be an individualistic, personalized approach for every individual and
Yeah.
depending on needs
Yeah,
rather.
yeah, yeah.
Oh,
So my
right.
treatment is usually individualized, and depending on the nature of the skin, on the type of the skin, and what needs to be addressed, we take this cosmetology into practice.
Oh, right. Okay. Gopi, this has been an awesome kind of an insight that you are giving to us, essentially. We look forward to seeing you in many more of these kind of episodes in the anti-aging process. Before
Okay.
we conclude this particular introductory session, is there is anything that you, as a specialist in both cosmetologist or dermatologist, would you want to advise our general public who are listening to us regarding the aging at all? Any golden piece of advice?
See, I would say that taking care of skin is not a hill task. So it's simple like a ramp walk. Okay, it's the thing is you need to be educated about the do's and don'ts of skincare, number one, and try to make your skincare routine possible as much as possible as a regular protocol at
Hmm,
home.
hmm,
Okay, because there are home based remedies as well,
hmm, hmm.
and do not jump into a conclusion seeing an ad and going after unhealthy what you call cosmetic products,
Okay, okay.
because these are all simple things which can be addressed.
Hmm,
Okay,
hmm,
and another thing I would tell is the being skin, it's the heaviest and the largest organ of our body, as we know.
yeah, yeah.
And because it's external, people think that you can apply anything, okay, to address anything.
Hmm,
So do not stick to what your neighbor says or the peer group says. Get
hmm.
the advice of a medical practitioner who is practicing dermatology. Okay,
Okay.
the truth, not the myths.
Hmm,
Okay, just go for with the facts,
okay.
because I humbly believe that we will not be overpowered with artificial intelligence in the near future. As dermatologists, maybe in your field or other fields, AI is overpowering the medical practice.
Sure.
But in dermatology, because we take a lot into, lot of things before jumping into a conclusion. I
Hmm,
think even gene-based skin therapies are in vogue. So in future, that's the future of dermatology, gene-based skin therapy. So
Okay.
your skin therapy will be based on this particular thing. So I
Okay.
think, yeah, before that, so we should not jump into a conclusion that everything suits everyone.
Okay.
Okay,
Okay.
so skin is the most important organ of our body, and let's take care of it. That's it.
Fantastic. Now, but before wrapping up with this session, two questions that I would like to ask, because since that you mentioned, one is in the, whatever the insights that you have given, you mentioned about methodologies, protocols in the form of lifestyle modification from the patient-centric, sorry, public-centric perspective, and also from your side as to what you can do to try and help them out. So both of them are for like kind of a scenario wherein the aging process has already started, or where you are trying to curtail it, or it is ongoing and you want to put a stop over it. Is there anything on the wall where you can reverse the aging process at all? Anything happening at all?
See, we call it as age reversal, in fact, but
Hmm.
aging, as I said, as I started with, it's an inevitable process.
Yes.
So we cannot stop put a full stop for aging. But
Yeah.
only thing is, let's age gracefully.
Beautifully said. I love that. I love that. Okay. And the other thing that you mentioned about where don't follow the myths that you mentioned about. Uh, are there any myths that are revolving around the world or the markets, which you want to put a full stop to as regards to aging, cosmetology, and dermatology is concerned, or it's nothing to be too much be worried about?
See, myths in the sense, what I feel is beauty as we see is in the eyes of the beholder, as we
Oh, yeah,
know.
of
Yeah.
course.
And definitely, beauty and healthy skin has an impact in the society, a
Hmm.
positive impact in the society.
Yes.
So, yeah. So, do not go for artificial beauty.
Okay.
Natural beauty is within.
Oh,
Take care
yes.
of your health, take care of your skin, and it will take care of you.
Fantastic. Good. Okay. Now, Gopi, coming to the forthcoming sessions, in what are all the things that you would like to cover so that our viewers will be looking forward for your insights upon the various topics that you are going to touch upon?
Yeah. So I'll be talking in detail, elaborately on the skin and the hair and the nails issues, as well as sexually transmitted diseases and how it can be prevented. I'll be giving you the tips. I'll be giving you the do's and don'ts. I'll give you all the practical implications for anything and everything about skin, hair, nails, and sexology.
Fantastic. Gopi, that's really awesome. It's been a blessing that you have come to us, and I'm sure our viewers will be glued to the program to watch more about your insights you are going to offer to us. Much appreciated. Look forward to seeing you in the very near future in the rest of the episodes. Take care then.
God bless you. Thank you.
Cheers then. Bye bye.
Bye.